Go.
Hi, my name is Hamdi Mursal. Thank you for coming. This is my final speech. So I'm going to use terminology we learned in class to involve it into my future career, which is a future doctor. A good doctors communicate effectively with their patients. They'll deal with all types of people from different types of cultural backgrounds, personalities, religions. So it's important that we understand people in a way that we can communicate with them. Doctors need to have strong communication between them and the patients to get an accurate diagnosis and to build trust for future treatments. Dealing with people with poor health and psychological damage, I have to be very careful and cater to their needs. Only way I can do that is to listen. For example, listening to interpret, as known as empathetic listening, it goes beyond comprehending what a person means. It allows me to further understand a person's situations, feelings, which is important to allow me to assist this person in their health needs. Having to interact with people from different cultures and personalities, and understand the fact that not everyone wants to reveal everything to their doctor. I mean, how many of us have went to the doctor and downgraded a symptom or not even include it at all? Because we know we're not supposed to do it, so why would we tell our doctor? So with that, knowing that patients are not always most honest, it's important to master nonverbal communication, because nonverbal communication allows me to send and receive information through all my senses. That way I can draw more information when interpreting a patient's message. So as a future doctor, I need to pay attention to the patient's certain movements and reactions to dishonesty. For example, their tone. I mean, how many of us, when we lie, we tend to whisper, mumble it, something like that. Our facial expressions, usually we have guilt written all over our face, like I'm lying. Eye behavior, which reveals the most out of all facial features. People tend to avoid eye contact, or you can just read it in their eyes. Finally, an important aspect of communication as a doctor will be to master at some points with emotional intelligence. We have to understand the patient on an emotional level as well. As a doctor, I want to reveal some emotion. I want to show you that I'm listening. I want to show you that I care. I want to show you that I feel your pain in certain ways. I want to be sympathetic with my patients, show them the respect, and with all those emotions involved, that will build trust between me and my patient, allowing me to draw more information from them, allowing me to properly diagnose them, and allowing me to set them the proper treatment they might need. With trust, you have to be confident. Meanwhile, it's important to recognize your own emotions and to learn how to control them. We are humans too. Doctors don't have to be made out of steel. We're going to feel certain emotions, and certain emotions are okay to express. Certain emotions are not okay to express as well, like emotions of anger, frustration. You don't want to show the patient that you're being frustrated with them. You want to remain calm and cool at all times. You don't want to show a patient that you're disgusted with whatever they're diagnosed with. And you don't want to show them that you're scared of them. You don't want to show that you're scared of their illness, their cuts, their bruises. With all this knowledge of communication, I think I will be a very good doctor. With my respect and the ability to interpret listening, my nonverbal communication, I can better aid in many patients. I don't think doctors need to be tough all the time, like I just said. So having emotional intelligence can help me assist patients better. Communicating with a person on an emotional level will further you as a good doctor. I'm sure it'll be an amazing contribution to any hospital. My goal is to make the patient comfortable, to show them that I care about their well-being, and to make sure that they are heard and taken care of. Thank you.